Hi guys, so quiz 1 is a wrap and we're on to quiz 2. Instructions for quiz 2 are posting today as well as your feedback from quiz 1. I strongly encourage you to go read that feedback before you continue into quiz 2. So let's go back and look at quiz 1 real quick and see what the right answers were and what we were hoping to achieve with this quiz. So we found a patient, Mrs. Jones, who was coming to the physician's office from the physician's office for uncontrolled diabetes. And she presented with a couple of things that kind of made us take note. So she had the uncontrolled diabetes. You also notice that she stares out the window, that she has a heart rate that's elevated at 112, a blood pressure elevated at 150/90, a respiratory rate elevated at 24. And this is actually kind of a low grade temp, so there also might be something going on here as well. We could look at her home medications and see that she was being treated not only for diabetes, but also depression and also anxiety with the Xanax. And so when we ask the question of how bad is your pain on a scale of 0 to 10, she says, it is what it always is, bad. And that's the response we get. So the question is, what information in the initial assessment led the nurse to ask about Mrs. Jones' pain? So there are a lot of things here. We could see her increased heart rate, her increased respiratory rate, her increased blood glucose, and also anxiety and depression. All of those things could be factors or signs that our patient is in pain. So we knew we should ask the question. Now, the next question was, what is the nurse's next course of action regarding her pain assessment? So it's really kind of two things that we need to be looking at here. So the first one happened right here when she said, it is what it is always, which is bad. And we know this is an inaccurate assessment. This is not something that we can note. And we're not going to make those numbers up because our assessment ability is very important to us as a nurse. So we need to probe further and get her to give us an accurate number. Now, she absolutely cannot, even after education, give you something on a scale of 0 to 10, then you need to come up with a scale that would be appropriate for your patient. In her situation, I might try the one that we utilized from the VA, the new scale at the VA, where it actually has descriptors about the differences between pain that's a 1 versus pain that's a 10, and see if we had better luck. The second piece of what we needed to do was some sort of additional pain assessment. Now, in our course, we talked about PQRST, but there's a lot of different ways that you can do that, and a lot of acronyms that you can utilize. And someone actually mentioned those in one of their comments, which is great. I love that you're bringing in information from other courses. Excellent work. So it doesn't matter to me which one you pick. What matters to me is that you know that that's not the end of the assessment. The scale of 0 to 10 is only the beginning of the assessment. Okay, and that answered question 1 for us. Then we moved on to question 2, and we did the scenario guided you to show that we did what I talked about with the VA, and we asked her to give us a number, and we did our PQRST assessment. And then it says we didn't have orders for pain management. So we called the doctor, and the doctor gives us Lortab every 4 hours as needed for pain greater than a 5. So first off, excellent catch on you guys who picked up that I didn't give you a route. That was not intentional, but I love that you called it anyway. So good job there. Okay, so then the question is this order appropriate? And if it is, why or why not? And is there any information you would want to convey to the physician? And then again, if yes, why or why not? The answer to this really is all kind of intertwined. So there's a couple of pieces that we'll talk about. First, we remember from our course about the total suffering, and that's up here where we're looking. And we remember with the total suffering model, she has a lot of things in here that are out of whack. And so for that reason, that indicates to me that she may need some sort of psychosocial support. So some sort of consult with either psych or with physical therapy or occupational therapy. Caseworkers could get involved, but a psychosocial assessment here or consult would be very beneficial in this patient. The second piece that we want to talk about, in addition to the fact that she's got some depression and some psychosocial issues that need to be addressed, is the type of pain that this patient is experiencing. So if we remember from the course that we from Module 1, as we went down the pain ladder and we talked about the pain medications that were appropriate for each point in the ladder, where was her pain? Is she a nociceptive pain, inflammatory, neuropathic, or dysfunctional? Well, while we're not 100% positive, we can be 99.9% positive that her pain is going to be neuropathic. That's what we're anticipating it being from her uncontrolled diabetes and from the descriptions that she gives us. So with it being a neuropathic pain, which pain medication category would be most appropriate for her pain? The adjunctive is exactly right if that's what you guys selected. Opioids might help short term, but we're talking about a more chronic pain problem. So is an opioid the place we want to start? No, we don't want to start with it. We want to start somewhere else. So we should be giving some sort of neuropathic pain treatment, like, for example, a gabapentin. There's several options that are here. So that would be another question that we would need to ask the physician. Another reason I have a problem with the lower tab right there. Additionally, we remember from this course, if not from other places, that extreme caution should be used when giving benzos with opioids, and this patient is already on a benzo. So when we give the opioid to this benzo patient, we increase the risk or the likelihood of overdose exponentially. And for that reason, we would also question that before we gave the Norco. Not telling you you can't do it. I'm just telling you it should raise a significant question in your mind before you do it. Okay, and so those were the answers to the questions. Now let's look at how your grade came about. And I'm going to go ahead and tell you I'm an extremely analytical person. I provide you with a rubric for a reason, because that's actually what I'm going to give you your points based off of. And it's very clear on here where your points are going to be deducted. The biggest problem that we saw here was about two things: the conversation and the one about and the number. So it was two things that caused this problem. They both kind of were in conversation. One about a meaningful post. What is a meaningful post versus a non-meaningful post? So if you look back over here in my description right here, it talks to you about it is not a meaningful post is not met by restating or agreeing with the primary post. And I don't care really how many lines this response is. It could literally be 2 sentences and be an adequate, meaningful response, or it could be 40 sentences and not be meaningful. It's not about the quantity, it's about the quality of what you do. So if you go back and read your response and everything starts with, I agree, I also like that you, oh, I think you did a great job with, or we're thinking the same way when you say such and such, those are all restating and it's not adding the conversation. Make sure that it's a meaningful response. The second piece I think we might have got some confusion on was the number of classmates you were supposed to respond to. So you can see that we wanted responses to all 4 classmates, and I wanted you to check in more than just one day. So you should be in there coming into the discussion feed at least twice, and you should respond to all 4 classmates. So let me make a statement about those classmates who chose to wait till the last minute to post their primary response. That's not a very team-like behavior, number one, and not a way to get you a whole lot of brownie points with your team. It's very difficult for others who post and then keep checking back all the time to see if you're posting, waiting on your post. So you essentially have 4 people waiting on you to make your primary post. I would strongly encourage you to do that earlier than the last day, if for no other reason but courtesy to the people that you work with in this group. So that's one side of it. The other side of it is this. These days that you're required to respond on are always scheduled. So you've had this schedule from the beginning. So I understand your frustration, and I agree that I would like people to post before the 18th. However, if they don't, it was already scheduled for you to come in on that day. So I get that it's a pain, but it's something that we're going to have to deal with till you can get all your teammates on board and posting in an appropriate time frame. I think other than that, you guys should probably be able to understand the points that were deducted. If you don't understand, you're always welcome to call me, text me, email me. My contact information is on the home page. So if you have any questions, I'd be happy to talk to you. Thanks and good luck on quiz 2.